Hello everyone. I am Dr. Abhishek Singh, Senior Consultant, Dr. O.P. Chaudhary Hospital and Research Center, Lucknow. Today we are talking about the importance of active life in our musculoskeletal health and their impact on our day-to-day life. The musculoskeletal health plays a key role to keep up good mobility and dexterity in an individual, along with enhancing their ability to work and actively participation in all aspects of life. Good musculoskeletal health is also crucial to maintain economic, social, and functional independence across their life courses. The physical activity has also has a important role in reducing other non-communicable diseases like osteoarthritis, like your cardiopulmonary risk factors. The relationship between painful musculoskeletal condition and reduced capacity to engage in physical activity. Impaired musculoskeletal health can lead to acute and chronic pain, causing physical limitation, proceeding in loss of participation and withdrawal from usual social community and occupational activities, further decreasing the quality of life and well-being, including mental well-being. There is a strong relationship between painful musculoskeletal condition, lack of physical activity, and resulting functional decline, frailty, loss of well-being, and independence, as well as depression symptoms. An individual with arthritis and musculoskeletal disorder is sure to be lesser active than the individual without the painful conditions. So, if anybody is having this painful musculoskeletal conditions, he will be less active, he will be more depressive, and his functional and mental abilities will be reduced. So, the impact of this impaired musculoskeletal health is now recognized globally and with an increase in morbidity and mortality related to it. Good musculoskeletal health is crucial in maintaining an active, productive, and prolonged working life. With an increase in the global retirement age, maintaining good musculoskeletal health is very important. If a person who wants to work for a longer time, he should be very fit musculoskeletally and he should be free from pain so that he can cope up with this day-to-day routine practices. High-income countries observed that musculoskeletal condition to be one of the major cause of work loss and early retirement. This is also seen in doctors also that the retirement age has been increased by the government and doctors are working for a longer time. So fitness of the musculoskeletal system is very important. Now, if we talk about the burden of diseases related to musculoskeletal conditions, then the non-communicable disease now account for the most of the global burden of diseases with the musculoskeletal condition being the leading contributor. Whether it will be arthritis-related problem or cardiorespiratory problem, all the problems are directly related to the musculoskeletal condition. And the global impact on the economic and the morbidity is very high. Since age is the commonest risk factor for the musculoskeletal condition, it is estimated that by 2050, there will be a 5-time rise in the people over 40 years living in developing country, contrasting to the wealthier countries. Additionally, obesity, another important risk factor for many musculoskeletal condition, is also hypothesized to rise dramatically in the developing world over the coming 2 decades. Furthermore, increased use of motor vehicles is not only reducing physical activities, but also increasing the number of motor vehicle accidents and resulting musculoskeletal trauma and disorders. The sustained and systemic urbanization in developed countries has led to sedentary behavior along the people, particularly younger ones. So, and the role of physical inactivity and sedentary behavior is very high in increasing these musculoskeletal conditions. Increasing physical activity and optimizing exercises is recommended by all the researchers across the globe. Evidence shows that the effect of sedentary lifestyle can be reduced by a small amount of activity every day. WHO recommends that nearly 2 hours per week of moderate exercise or about 20 minutes per day of any kind of physical activity like brisk walking, cycling, or anything that anybody likes is recommended. These exercises elevate heart rate and known to be associated with the lower lifetime risk of cardiovascular diseases. Apart from rendering musculoskeletal health benefits, improvement in cardiorespiratory fitness may be achieved by changing sedentary behavior to achieve a low intensity physical activity like walking. One can also adopt a habit of using stairs and walking small distances throughout his day so that the physical activity is continuously done. rather than following a sedentary lifestyle. Exercise is now widely prescribed for the rehabilitation of musculoskeletal injuries, and its use as a preventive health measure is now widely investigated. Low back pain and neck pain can be benefited by staying active and exercising regularly. Group exercise programs to weight loss programs can be considered. To reduce the incidence of fall balance and strength training, home hazard assessment, participation in fall prevention programs, and getting involved in activities like gardening, dancing, etc., will also help. Osteoarthritis has been shown to be benefited from activities and exercises and improve muscle and aerobic fitness like walking, swimming, and weight loss support can be rendered if required. There is one more important point that aging is inescapable, and we cannot escape our aging process. Aging process is inherent. It will come to everyone anyhow, but it can be made easy and healthy with the help of exercise. Exercise renders many benefits to the aging body, including reducing the manifestation of aging, especially the aging phenotype of the elderly. Those who are active and those who are doing regular exercises will have a lesser chance to develop osteoporosis, and physical exercise programs also improves strength and balance in aging women with the postmenopausal osteoporosis. Additionally, fragility fracture risk associated with the osteoporosis can be decreased by following an exercise program, as exercise increases bone density and reduces inflammatory markers. Thus, having an active lifestyle from an early age and following recommendations for exercise should be beneficial for women and men as well. Furthermore, exercise and mechanical loading also have a positive impact on the molecular, cellular, and tissue level. Like with aging, the potential for cell proliferation and the number of stem progenitor like cell decreases in tendons. Exercise loading can induce an increase in tendon collagen synthesis, thus increasing tendon strength. Physical exercise and mechanical loading also have a positive role in maintaining cartilage and bone health. Moderate exercise could also enhance the quality of tissue produced during the healing of injured tendons. There is also a direct relationship between obesity, diabetes, and the musculoskeletal disorders. Those who are obese has a high risk of developing diabetes. Also, those who are obese, they are having a more uh, strain over their musculoskeletal system. This is important comorbidity for many musculoskeletal conditions, and it is closely related to development for osteoarthritis. Osteoarthritis is one of the commonest musculoskeletal health issues nowadays. So, the strategies aimed at reducing obesity in adults will also reduce the occurrence of osteoarthritis and thus can alleviate some of the pain of the condition. Increasingly, obesity is one of the most modifiable risk factor for the osteoarthritis. Exercise and weight loss have benefited overweight and obese adults with knee osteoarthritis in various clinical trials. Thus, combining modest weight loss and moderate exercise can provide the best overall improvement in symptoms of the pain and joint functions. If lack of exercise is since childhood and a person is obese since childhood, then this will create more musculoskeletal pain in later life. Thus, reducing obesity in children by encouraging physical activity and encouraging their playing hours will also reduce the risk of developing musculoskeletal problems in later life. Diet is also an important factor. Those who are obese since childhood or those who are suffering from obesity should render themselves to the healthy diet, low fat diet, and moreover, everybody knows that diet is one of the most important part of being healthy. A 3-year follow-up study, including about 400 adults, showed that the diet high in potassium reduces the amount of muscle loss in adults in more than 65 years. Content of potassium is very high from the fruit sources, so the intake of fruit should be encouraged in those who are elderly. Improving the diet of osteoarthritis patients have also shows great benefits. Vitamin D, calcium, and particularly protein consumption have been shown to optimize muscle, bone, and functional outcome. Thus, dietary strategies in improving musculoskeletal health should include consumption of long chain fatty acids, vitamin D and K, and decreasing blood cholesterol. Antioxidant rich diet may also benefit in athletes by improving tissue repair. So, my advice for everybody is you should always stick to a healthy lifestyle. You should always continue exercises you should always stick to healthy diet plans, including more of the protein, long chain fatty acids, vitamin D, vitamin K, and calcium containing diet. And you should exercise regularly so that the musculoskeletal disorders can be reduced substantially. And that will include your daily living lifestyle, and also working age will be increased. So there will be economical and overall benefits. Thank you for watching this video.